Morning. Thank you, everybody, for joining. Today, we have a free technical briefing. My name is Carson Hetty. I'm an account executive in St. Louis in the healthcare space, and I'm joined today by Bridget Workman. Bridget is going to be leading us through the presentation today on the competitive advantages of DG and MDM in healthcare. Bridget is a principal MDM solutions consultant with deep expertise in health. She specializes in helping healthcare organizations with their data-driven initiatives. Bridget is one of the leading subject matter experts in the field of healthcare provider master data management, also known as MDM, and has worked with several of the leading health systems in the United States in connection to their master data and data governance initiatives. Bridget is the recipient of several industry awards, including the 2018 HC Pro Credentialing Resource Center Case Study Award for MDM Excellence. She's also a Gartner Top Quadrant MDM Healthcare Business Partner. She is a frequent speaker at national conferences in data governance, MDM, and best-in-class data management practices. So without further ado, thank you again for joining, and I'm going to turn it over to Bridget.
Good morning, everyone, and I appreciate you guys taking your time out to attend today. Before we get started, I actually want to share with you that I'm pretty excited to share the content today, not only the slides, but also some of the talking points that I'd like to feature, because I'll be presenting some of this content next week, actually, in Washington, D.C. at a data governance and master data management conference. So if any of you are planning on attending that vision conference, then I'd be glad to dive deep with you there in person live on any questions that your organization might specifically have. But nonetheless, you're getting an early opportunity to take a look at some of the content that will be shared with the attendees at that session. And then I might also mention that at the close of today's presentation, Heidi has the slides, I believe, that will include some bonus features, some content that includes questions that clients commonly ask, or when I speak to various different audiences, it includes the most common questions or things that organizations perhaps have not considered. And so there'll be some additional slide content that's shared out with participants today. So as we get started, I do want to just give a few talking points about this particular body of work, master data. I think most of you, in the healthcare space right now are definitely feeling the demands to be able to deliver concentrated data, to be able to deliver not only transactional data, but the analytical data, to put it into the hands of the various different users, the vendor partners that you work with, but to be able to do so with high data quality and also in a timely manner. So what I'd like to do today is to actually open the doors up, so to speak, and talk with you about some of the things that make master data a really powerful tool or a really powerful process that an organization can employ. And the reason that we're going to talk today about the provider domain, so to speak, is because whether you're coming at it from a payer perspective or from the perspective of a healthcare organization, perhaps an HIE or a health plan, a health system, in any of those types of entities, provider is something that everyone is challenged with. And so let's go ahead and dive in. What I'd like to do is talk briefly about the process that many organizations have taken. If they don't have master data in place, you'll find that a lot of them instead partner specifically with different areas of the organization. And on the screen today, you can see some of those common business partners or different data sources that will be partnered with to really try to consolidate, to draw together, to improve the data quality of the provider data for the organization. And if you come to today's presentation with the perspective of a health system, you may partner heavily with your credentialing teams. You may partner with the folks who work in your payer teams or your medical staff services organizations or your CVOs in order to be able to get the data that you need on a daily basis. But one of the strategies that you'll often see publicized has some limitations, and that's in looking to those folks that I just mentioned to you as really being the source of truth, so to speak. There's limitations on what those folks are able to manage and the types of tools that they have at their disposal. And so that's why it's really important to look at what kind of other technologies exist across the space that could better serve your organization and really produce the type of data that you need in the manner in which the organization needs to consume it. So what I'll do is I'm actually going to share with you some specific slides where most commonly I'll see clients. I think I'm going to share 2 slides. And on the next 2 slides, you'll see specific areas within organizations where we see these are the key stakeholders. They're going to be the key clients of master data, of provider master data. And one of the things I absolutely love in working with clients is being able to hear about success stories, how it's absolutely it being master data has absolutely transformed how people either provide their reporting and analytics, and absolutely love the success stories when you hear about patients who are able to get to the type of provider, the right kind of provider, the right kind of specialist, because they have access to the type of data that they need. And so on these 2 slides, you'll see examples. And of course, depending on what your specific use cases might be for your organization, you may even have more, but these are the most common ones that I've observed. And I actually think I have ACOs on there twice. I might actually call out that the ACOs tend to be very large consumers of master data. It makes big differences in their delivery times and being able to compile data and get it out the door in a timely manner. So what we'll do now is we'll just talk briefly about the types of things that we're going to be covering today. And I know that people may come to today's presentation with a variety of backgrounds. You might be a senior executive who is wondering, is this something that we should do for our organization? You might be a solution architect or a developer who's being tasked with trying to create your own source of truth or create your own master data. So what I want to do is I kind of want to just cover a few slides with folks today that talk about what is master data kind of at a really, really high level. And then we'll start to dive a little bit deeper. So for the next few slides, I'm simply going to give you guys some examples of where master data can help an organization. And for those of you who are in the weeds of the data, perhaps having seen your own data within the organization, you can very quickly discern that the example that I have on the screen is something that is all too common. So as you can see with my cursor, when I point out to you the example of the various types of degrees that might be present across an organization that exemplify, as you guys would know, one particular type of degree, it makes it difficult to be able to pull that data together and be able to present it to users in a way in which they can slice it and dice it and make it available instantaneously. The other area, the 3 examples that I have on the screen also have to do with, is this particular clinician, or I'm going to use the term provider throughout the presentation, is this particular provider one who we want to have in scope for the work that we're developing, or for the particular reporting that we're developing, for the particular predictive analytics use case that we're working on. And in order to do that, master data is able to help standardize on these particular values so that a consumer of the data can then access it in a way that they don't have to have that deep understanding of the healthcare space. The final example I would say would be around specialties. And certainly, again, these are just examples. There's many, many, many out there. But these are ones that I think speak to all of us who are in this space. So the final one has to do with specialties and how you see so many variations of specialties, and then being able to really get to the crux of how the provider is practicing impacts everyone, whether it has to do with the reporting that they have internally or reporting that they have to do externally, perhaps with CMS, external vendors, claims. A big area in the space right now for master data is helping resolve and close claims in a more timely manner. And certainly, as you saw in the slides beforehand, where I exemplified the most common use cases, provider directories is a big area to be able to get the patients connected to the right type of provider. So the next slide that we're going to take a quick peek at would be the slide that it exemplifies how within your organization, there's no doubt that you're also needing to access data from other sources and to be able to bring in that data. So what I'm sharing with you is an example of this particular data happens to be publicly available. So the example that I'm sharing with you comes from medical state license information that's publicly available. And then also data that would be available from CMS to be able to pull in all different kinds of external reference data to be able to identify your providers, to be able to match them up. So the reason I use this example is because you can probably immediately think, certainly there's external reference data that you can identify, but even internally to your own organization, you have other hub and spokes. So there's other spokes across the organization that you know are managing data that's important to everyone to be able to access it. So when you have master data or master reference data, you can pull all of that together and make it readily available to users across an organization. And the final quick example, kind of introducing people to master data at a very high level, is around the ability to cleanse data, to be able to, in essence, integrate data quality standards across the organization so that you're not constantly having to come to the table to have conversations around, well, who should we go to in the organization for this type of data and who should we go to them for that kind of data. And then once you create that partnership and that relationship and you start to get the data from them, you identify that perhaps things are missing or they're not populated in a way that you can actually use them. So through master data, through the process of developing master data, you're able to, as the slide depicts, actually cleanse the data prior to distributing it to users across your entire organization and outside of your organization. So that's kind of a high level of just some fundamentals. There's certainly a lot more that we could talk about today, but I'd like to share with people some of the benefits of having master data. And I think as Carson mentioned, because I've spoken at quite a few conferences, I tend to know the circuit of other folks from other payers or other health systems who also have master data, and we tend to present, not together, but we tend to present along the same lines because it is successful. It does help. It does make a big difference to an organization. So some of the areas where provider master data can really make a difference for the organization, you can see are depicted on the screen. And then what I'd like to do is just share with you some of the competitive advantages that it gives to an organization. So let's take a look at those. And as we do so, you'll note that some of these line items or these bullets that I have exemplified tend to be those areas that organizations trip over on a regular basis. And it's not that you can't solve for them separately, but if you're an organization of any decent size and you have multiple systems that are feeding, EMR and credentialing and the payer and the HR data and so on and so forth, perhaps even CRM systems, then you're going to have to be able to have a centralized means to manage some of the attributes that you're seeing displayed on the screen today. So as I've worked with clients across the nation, the bullets that you see on the screen are really the ones that as they get into master data, they start to see the really significant impact it can have on the organization in making data available. And the ones that you see on the screen are the ones that once they get to that level of maturity, they can introduce these, they can bring these to the table, and they can really start to make some strong gains across the organization. So we'll talk a little bit more about benefits. And then what I'd like to do is I want to save a little bit of time toward the tail end of the presentation so that we can have an opportunity to cover some Q&A or I can share some success stories from various different clients as they've introduced master data. So I'd encourage you to start to pull your questions together. And I think what we'll do is we'll use the chat in order to be able to cover those questions. So the next area that we want to talk a little bit about is how it can move the organization forward as a whole. So depending on where you're at in terms of, your strategic solutions that you're employing across the organization, MDM is often looked at as the heart of some of the data sources that an organization wants. So if you have a lake strategy, if you have a cloud strategy, if you have warehouse or warehouses or databases in place that the organization most commonly uses, when you're looking at developing those platforms or those solutions, master data is one of the sources. And it's not limited just to provider. I think provider would be a great area where you can start, but there's quite a few other types of master data domains that can be introduced. So you've probably seen, throughout industry materials that patient master, supply chain, and then location master or location master reference data can be also readily enabled. So when I say MDM, I mean all of those various different use cases can be introduced to the organization. So one of the topics that I would say people have a strong interest in is around predictive analytics. And I can tell you a really brief story on the topic of predictive analytics and provider master, in the sense that I had a client I was working with who had an interest in identifying how could they better discern what providers were spread across their various different markets that they served, who were not currently part of their medical staff, not currently part of the various different medical groups across the communities, but who might be available out there to be able to serve the need and the care gaps of their providers who were starting to age out and consider the idea of retirement. And because you all know that the ability to recruit providers across the nation right now is very, very, very challenging. And depending on the type of specialty for the provider, it can be a multi-year process. So they came to the MDM team within that organization and they asked, do you have data that we might be able to use, a data set that we might be able to use to discern where there are providers not only from the medical groups who are, often employed, if you can employ providers in the state that you're coming from, who are not only employed, but also the providers who might be on the medical staff at our different acute care locations, who might be in a position where they're thinking about retiring. They're considering those things so that we in turn can look at our different geographic markets to see if there's opportunities where we should start to partner in getting to know whether or not there's practice opportunities. And through master data, they were able to identify various different population segments where providers were in certain demographic ranges that you could predict the likelihood that they would be retiring within certain periods of time, whether that be, the critical masses of 1 to 3 years, 3 to 5 years, 5 to 10 years, so that they could start to take forward action in identifying who those providers were in the community and starting to develop those relationships. So that's one example of predictive analytics, how you can use the master data. And certainly there are quite a few others that clients have been able to customize their data for those specific purposes. So let's talk a little bit about other opportunities. I would say that one of the things that I observe in various different states is that there's either state-based healthcare information exchanges, or HIEs, or networks. And oftentimes a health system or networks needs to be able to exchange their data with one another. And as such, they need to be able to do so in a very timely manner. And we see a lot of pressure coming across organizations to be able to do so literally in real time, if possible. And so through master data, once you have master data in place, that is definitely something you can start to look at. I've actually worked with folks in some specific states where they were part of a health system who introduced master data, and they were able to then come to the table and participate in a lot of emerging initiatives with their various different healthcare information exchanges. The other topic that I have on the slide right now would be around distributed ledgers. And, there's a lot of work going on in that space, and certainly provider data, especially provider credentialing data, is not without interest. There's a lot of focus groups, a lot of activities, and a lot of the very, very large credentialing vendors and national organizations are working on developing, as you guys would know the term, a big blockchain around provider data. And so certainly if that moves forward, if that continues to move forward, as we're seeing the trend, then organizations who have master data will be in a position to be able to not only participate, but also be able to participate advantageously. So a few more areas that we'll talk a little bit about the benefits. And what I'd love to be able to do is, if we have enough time, I'd love to be able to just give you a few tidbits about those bonus slides that really drive into, how do you take those next steps? If you're interested in master data, what are the things you need to consider as an organization? So before we do that, we'll keep talking about benefits that have been observed around master data. So the slide that we have in front of us shares some of the benefits in looking at care gaps in care. I talked a little bit earlier about how it can help close gaps in claims. Certainly, like with referring providers, being able to drop those claims out the door because validations can take place more quickly. That's definitely an opportunity. Other opportunities would be able to identify the right kind of provider that needs to be connected to a patient. And interestingly enough, a client who had locations, they had acute care hospitals in remote geographic areas in the country. They were often challenged in being able to find the right kind of clinician for certain patients. And so their pop health team wanted to see whether or not they would be able to use master data. And they were able to, as a result of master data and being able to clearly identify other providers within their presence, like where the whole entire health system was part of, they were able to identify that there were providers already within their network, albeit not in the immediate geographic vicinity, but within their network, that they were able to make the connection for the actual patients. And so it started to create a really strong collaboration between different specialties. It opened doors to be able to really get the patients into the hands of the providers who had specialties, certain kinds of scopes of practice and privileges to perform procedures that were very hard to find across the country. So opportunities in that regard. So then let's talk a little bit at this point. What I'd love to do, since we're nearing about a half hour, and I want to leave some time for Q&A, is I want to give you guys a quick peek into some of those slides that I made reference to around bonus materials, as I mentioned. So the next set of slides that I'll super quickly move through are really intended for those who are either in a leadership role around master data, or they're sitting in the position of the lead architect or the technical folks who would be considering how they would implement master data. And so the next, I think about 10 slides or so, I'll just move through them pretty quickly to share with you some of the key talking points and considerations that clients commonly have. So from my perspective, I've worked with clients who not only are just starting the journey around developing, defining their various different domains for master data, but I've also worked with clients who have tried to take maybe a homegrown approach, or they've started to develop a proof of concept and they've been met with various different challenges. So the talking points that I have on the screen for you are really just considerations as you're looking to identify the kinds of technologies that you might want to use. And then also to consider, next page here, what kind of a solution do you actually want to implement? Do you want to be able to have a solution that everyone comes directly to your data source? Or do you want to be able to send your data, allow people to subscribe to the data, or send the data to a database or your local warehouse or your data lake? And then what kind of data are you going to be managing within master data? Are you going to have some data that's considered to be PII, protected information? Are you going to end up having data in there that needs to be able to have the security, the access and use, the groups for access created around it? And if so, what are the types of considerations that you need to give thought to prior to introducing your actual solution? And then a little bit of a consideration, some additional talking points on the same thought. A little bit more. In terms of some of the clients that I've worked with over the years, I found that folks tend to be eager to implement a tool once they make a purchase. And so as such, sometimes they feel the pressure to take shortcuts on how they access data. So my encouragement to you is to really always try to go direct to your sources, go direct to your partners. And I certainly can speak in more detail if that's something of interest, to know the pros and cons between going direct versus accepting other forms of data. Talk a little bit more about the benefits of having subject matter experts help you on your journey. So certainly there's quite a few folks in the master data space, across the country, but it's important as you're pulling your team together within your organization to make sure that you have the right subject matter experts, definitely have the right technical players at the table. You can see some of the folks identified over from the technical side of the house, but also making sure that you're not developing a solution that's, an IT focused solution, but making sure that you have that relationship, you have a means to be able to collaborate with the folks. And while that might seem absolutely obvious, oftentimes you can see initiatives that start and then it's hard to create the relationships with the folks in the business, or to know how to draw them into the space to be able to partner to really develop a strong long-term solution for the organization. So this slide is really intended to depict the need to be able to work together collaboratively and identify the types of folks that you should work with. So who are those folks that you should work with? This next slide identifies who most commonly would be the different subject matter experts that you could partner with across your organization. So as you can see from the slides I had shared before, I exemplified who you most commonly look to in terms of a data source owner. Well, these are the folks, then the subject matter experts who come from that space. So let's next look at what do you need to do? What are those next steps if you're thinking master data is something that would benefit your organization? This is just a really brief punch list. This is actually an excerpt from a toolkit that I put together for clients, but I pulled together an excerpt from it to share with you some of the common items that you need to give consideration to before you start to move in the space of, choosing a technology and implementing a timeline. And while these are just a list of bulleted items, certainly there's a lot more to talk about within each of these bullets. So I welcome questions in that regard if you have, as we get toward the Q&A section. Then a little bit earlier in the conversation, I made the mention that some organizations will try the approach of first partnering with their credentialing owners or the folks who manage the payer databases across the organization or even other data sources. And I had mentioned that there are definitely limitations in taking that approach. And so this particular slide gives a few talking points. If that's something that your organization has done, in short, because they're under pressure to be able to find a means to an end, and you're feeling the challenges of having taken that route, then certainly maybe reach out to Heidi or Carson, and I'd be happy to share some additional slide decks or some additional content to maybe help push you in the direction or to help pull the stakeholders in your organization to the direction of looking instead to master data as a long-term solution. The clients that I've worked with who have initially tried to identify what they've deemed as a source of truth from their credentialing systems or those other systems that I had mentioned have found over the years there's a lot of limitations to it. And I would say, given the pressure that we have on producing even more, managing even more data elements, more attributes for reporting purposes, especially in light of a lot of the changes that are forthcoming around bundled payments, various different CMS initiatives around reporting. It's going to be more and more complex for those data sources to be able to manage the demands on a long-term basis. And so that's why when you introduce master data, not only can you aggregate, pull together, match, standardize, cleanse, manage the data quality of the data, you can also introduce a process to manage reference data. So I don't want to get too technical in conversation to make sure that I'm able to have everyone's needs and interests met. And then the final slide just gives you a little bit of a visual in terms of how master data can benefit an organization. And this is just meant to be something you can use as you're talking to various different stakeholders across your organization, as you might be talking to them about the benefits that master data might provide to them, and or as you're talking to various different stakeholders, really trying to pull folks together at the table to get an initiative started. So kind of a visual aid that you might be able to use in that regard. So that wraps up the slides that I had prepared for today. And as I mentioned, I did want to be able to leave a little bit of time for folks to do some Q&A. And so Heidi, I think, is it appropriate that I turn it to you to be able to manage the Q&A piece?
Thanks, Bridget. I appreciate that. And I'm going to just turn this over to Carson as he owns the meeting.
Okay, thanks.
Yeah, I appreciate that, ladies. And I would say if anybody wants to post a question in the chat or come off mute at this time, feel free.
So I would definitely encourage folks, if you have questions, don't be shy. Some of the other webinars I've done for this particular topic, people a little shy at first, but then the questions that you might have are going to often resonate with the rest of the folks that are also on the call today. right. Well, I'm happy to talk a little bit about the various different data sources that can be used. I'm happy to talk about different kinds of external reference data that can be leveraged that you can bring into your organization. Or I'm happy to share if there's other areas that you think would be of interest in diving a little bit deeper. Oh, okay. We've got a question in the chat. How does master data management differ from a data warehouse? And I would say that the data warehouse, in brief, a data warehouse from a holistic sense is meant to manage either one or many different types of data sets for an organization. But master data is different in the sense that it includes data from many different data sources that are then aggregated together. And I actually think there's a slide I used a little bit earlier in the presentation that might exemplify it in this sense, where you have many, many, many different data sources. And in fact, I should probably have many different data sources exemplified over here. And those data sources are brought together and then they are consolidated so that they produce a single data set. So envision in your mind's eye all of the different systems, all the different data sources that I mentioned before. For an organization, depending on your size, you could have 5 or 6 different data sources, or some organizations I've worked with have hundreds of data sources. And so hundreds of those sources are then fed in to master data, where the process to consolidate and to match the records together to cleanse and produce then a single record, a single golden record or a master record, can then be made available to the organization. And then it could be pushed to or stored within a data warehouse or within a data lake. Or folks can simply come and access master data in whatever database that it's housed in as well. So great question. Master data is more a process, and certainly there are tools that are designed to support the process, and then the warehouse is used to store the data. What other questions do we have from folks? All right. Well, as I mentioned, participants today, I'll be sending, or Heidi or Carson will have access to the additional slides that are available that we can send out to folks so that you can have access to those as well. And then I think that they also have my contact information in the event that folks have questions or ponderings as to where they're at in their strategic approach for master data in their organization.
Absolutely do. Thank you, Bridget, for that. I would add, so again, the session today was recorded, so if you'd like to get a copy of the recording, if you missed any of it, please just let me know. I'm happy to send that your way. Same with these slides. Thank you so much for joining. Anybody else, any last thoughts, questions, comments before we close the session for today? Bridget, thank you so much, and thank you to all for joining. Hope you have a wonderful rest of your day and week.
Thank you.
Thanks, everyone. Bye-bye.
Bye-bye.